Hi again, this is Wellbeing Teams Part 2, and I've explained the challenges of traditional commissioning and wellbeing teams in the first 10 minutes, and I was starting to explain about Thurrock. So Thurrock are working with us over an 18-month pilot where we're supporting, and that means we've recruited 2 teams, and they're using all our principles and practices and wellbeing teams. But what we're doing is bringing together community support and re-ablement and home care together. So that means it's a partnership with health and social care, and we're evaluating the difference that we make to both people being part of their community through something that we're calling Circle Family, which is a bit like social prescribing, where we're supporting people to really be connected into their community and delivering practical day-to-day home care type support and re-ablement support, and that's really exciting. And we're working with another local authority to do something similar but based in a GP's practice, and having re-ablement workers and possibly a social worker as part of the team. But it's being commissioned very differently, not on time and task, because actually home care is the only part of health and social care that's commissioned on time and task. So if you're interested in a wellbeing team's approach, it would be really exciting to do something like Thurrock and other areas that we're working in, which would be to choose 2 neighbourhoods, to invite us to support you to recruit them, and we could either do this through an existing provider that we've got a lot of faith in, that you really trust, who's really bought into this way of working and up for doing something radically different with 2 completely new teams. Or if you have in-house teams, that we could again support 2 new teams to work really differently. And do that over a period of 2 years, and ideally bring together re-ablement, community support and home care. Because the honest fact is, if you were asked to design a service to support people to live well at home, you would not design re-ablement that lasts for 6 weeks, separate from home care, separate from social prescribing and community support, and separately from some of the things you're probably commissioning charities in the local area as well. So I think we need a really fresh approach to supporting people to live well at home and be part of their community that could include some basic healthcare tasks. Somebody we supported in Wigan, the district nurse would come in the morning and give the guy injections. We would then support him to take his medication. We'd come morning, noon and night, and the district nurses would come in the evening. And that's just ridiculous for the person and the number of people coming in and supporting him and the cost of that service. So we said to the district nurses, how about you support the guy to take the medication? They said, oh no, that's home care's job. So I think we've got 2 solutions here. Either organisations like ourselves get trained up to do some simple basic healthcare tasks like that as well, which frees up district nurses, or we have district nurses as part of our team, so we work much more flexibly together. So I think it's an exciting time to try different things, but it requires radically different commissioning. It's not the outcome-based commissioning that's talked about at the moment. That changes the numbers but not the game. It's a really different partnership with a provider organisation and working together with complete transparency over money and how money is used. And we would be delighted to be part of doing that with you in Islington if you're interested. Please let us know. And the other possibility, which is what we did in Wigan, is we did a development programme for all of the providers to move them towards a greater outcome focus and greater person-centred care and greater autonomy for staff. So not the full wellbeing team model, but moving in that direction, whilst also delivering wellbeing teams. So then all your providers move in this direction whilst demonstrating a different way of working and what's possible. So please let us know if you're interested in exploring anything like that. The future's got to be supporting people to live well at home, that integrates health and care, that's connected to GP practices, that offers practical support, re-ablement and a big focus on community. And we'd be delighted to be part of it. Thank you.